When a student in your class has a mental illness, he may struggle with concentration, understanding instructions, self-confidence, and comfort around others. He may feel out of place. He may be struggling with severe anxiety, depression, or distorted thinking. He may be doing something that is disruptive. He may become frustrated, or at times maybe even angry. He may be reacting to past or current trauma. You may not recognize that what your student is saying or doing is a symptom or a response to the symptoms of his mental illness. So what can you do? We have included here some guidelines that will help you respond effectively to your student who is struggling with a mental illness and to minimize disruption in your class. The pressure on teachers to maintain order in the classroom, to make sure that all the students are safe and that they learn, and the very nature of trying to teach a room full of students, all of whom are different with different needs and interests, are all formidable tasks. The following suggestions, do not forget these challenges. These suggestions are provided because they can be very effective. There will be times when you are able to fully implement some of these and times when it will be difficult, particularly if there are other students who are demanding your attention. But if you keep these tools and insights in mind and use them when you can, they will help you to provide your student the support and validation he or she needs while reducing the disruption in your classroom.
If you have a student you know or suspect may be struggling with a mental health challenge,
sit down with her alone and allow her to talk about how it impacts her, so you better understand what you are apt to see in the classroom, and also so she knows that she can be open and honest with you. Be sure to not challenge how she is feeling, but instead to let her know you understand her and will work with her. Instead of focusing on the behavior, ask yourself, what might your student be responding to? Consider that he is likely dealing with some kind of symptom. It may be depression, anxiety, difficulties concentrating. He may be hearing voices. He may feel that something is going on that might be threatening to him. Keep in mind that while you certainly need to minimize disruption in your classroom, you can do so while subtly responding to your student. Perhaps quietly taking him out of the classroom where you or another school official could talk to him. If you see your student struggling, quietly ask your student, is everything okay? Is there something I can do? I can see you're having difficulties in class today. How can I help you? When correcting a student's behavior, do so in a supportive manner. You might say, John, I can't have you bothering the other kids, but if you're having difficulties staying focused or if there's something else going on, let's talk about it after class. If you need to remove a student from your room to avoid further class disruption, do so in a quiet, supportive fashion, such as, John, let's step outside to talk for a couple of minutes. Sometimes the classroom itself can cause a student's anxiety level to increase. You might ask your student how he feels in class. Ask him about his desk, where he is seated, if he feels crowded in class, if there is anything that is making him uncomfortable. It could be the lighting, the proximity to the windows, how far forward or back he is seated, or sounds in the room. If there is something that is making him uneasy, consider ways of making changes that might help him be more comfortable in the room. If you can, help to reduce the pressure your student may be feeling. You might do this by asking her if she could use some extra time to finish an assignment. Not only can this reduce the pressure she is feeling, but it can demonstrate to your student that you care. This will promote trust, which will make it easier for your student to come to you later if she's feeling the negative impact of her symptoms. Sometimes the symptoms of mental illness can be draining and fatigue can set in. If you see that in your student, you might allow her to go to the nurse's office for a set period of time to lie down until the fatigue passes. Otherwise, you might just let her put her head down on her desk for a few minutes without bringing attention to her. Sometimes a student may need some time to be alone. Arrange a safe place ahead of time where a student can go where there's minimal disruption, perhaps in the waiting room of the school's office or the nurse's office. Be sure if your student comes to you and lets you know he is struggling, that you let him know that you are taking him and his feelings seriously. If your student becomes argumentative, remember that this may be a response to the anxiety, hopelessness, confused or distorted thinking, or negative perceptions of his environment, all of which can be responses to the symptoms of his mental illness. Try to focus on helping him to feel more secure. Be sure to validate and compliment your student, even for small gains. If your student feels like she is defective, unable, or a failure, it can further deepen her negative beliefs about herself and can result in her not believing she can succeed. It can also result in her no longer making the effort to succeed. There are so many issues and considerations when working with students in a classroom that there is no one rule or set of rules that will work all the time with every student. The key is having multiple tools available to you. If one does not work, try another one. Of key importance is that when a student is struggling with a mental illness, is to understand that what may look like undisciplined behaviors is most likely responses and coping or protecting mechanisms intended to control or otherwise deal with their symptoms. These symptoms can be scary, frustrating, self-persecuting, and unpredictable. It is understandable that kids may find it difficult to respond to in a positive fashion. So while needing to maintain order in the classroom is very important, doing so in a way that is sensitive to your student's illness is key. If you have any questions, please contact us through our website at www.transmhs.org.